Welcome to the video for Sunrise Computer Training for Nursing Assistants at Jefferson Northeast. To access the Sunrise Clinical Documentation System, select the Sunrise 16.3 PROG icon from your desktop. The Sunrise Documentation System is used for clinical documentation for our inpatients as well as our emergency room patients. Toward the upper left, current list. Here you'll have access to all three Jefferson Northeast campuses. B for the Bucks campus, F for Frankford, and Chi for Charsdale. Today we'll be working at Frankford 5 East. On Frankford 5 East, I have 31 patients or 31 visits. I highlighted Eve Arden. Her name appears at the top of the screen in the header. I can see her bed, her admission date, her allergies. This is the attending physician. This first set of numbers is her MR or medical record ID number. The second set is the account or AR visit number. Age, date of birth, gender. If this were the real Sunrise system, her preferred language would be here. And if she were on isolation, that would also be listed here. To get additional information about this patient, Eve, I would then be able to open the rest of her chart, such as orders, results, documents, flow sheets, and so on. The first tab, Patient List, is open by default. You can customize your patient list by adding and removing these different columns here. To do that, you select the icon, select Visit List column. The box on the left are the columns that are available. If I would like to add one of these columns, highlight and add. The box on the right are the columns I currently have displayed. If you wanted to remove a column, highlight and remove. Once you have your columns, you can then resize the columns, and you can also click and drag and move the columns around. If you would like to create your own personal list, highlight your group of patients, click and drag. If your patients are not in order, hold the Control key on your keyboard and highlight non-consecutive patients. The button toward the upper right, Save Selected Patients. You then have to give it a name. And OK. I am now seeing only the 8 patients that I chose for my list. Personal lists are always at the bottom of this current list menu. You can then add and remove patients to this list as your assignment changes. For example, if Gene Kelly was being discharged, I would highlight his name. And when I'm finished with his documentation, I can then remove selected visit or the selected patient. To add additional patients, I would go back to my unit, which is Frankford 5 East, highlight the new patient, and again, save selected patients. My list is already highlighted and OK. To get additional information about your patient, I would then use these other tabs here. Some of the basic columns on the patient list, obviously, is patient name and their location, providers, their attending physician. Any of our patients who are now admitted to the hospitalist groups, the hospitalist free checks their name and their phone number into that column. Our oncology physicians also do that. You then have these 3 optional columns: flag new, new results, and new orders. Most nursing assistants do like to use these, especially the new orders. If you would like to be notified when you have a new order or a new result in the system, you have to turn the flag new box on by double-clicking into that box. When I double-click, I develop this X, and that is turning the flag on for my patient. I have developed green flags in the new orders column. These fake patients here don't actually have any results, which is why we did not develop any flags here. you'll either see a red or green flag. A red flag means one of those orders is stat. A green flag means they're routine. To view the orders, a double click over the flag, and I can view the orders that are new for this patient. Once I've seen those orders, I can go ahead and clear the flag. And we generally kind of start the shift off that way, clearing your flags, kind of start with a clean slate. And the next time you log back into the system, if there's a new flag there, it's notifying you that something new has been ordered for your patient. The DNR, they've changed the wording here. It's now POLST, which stands for Pennsylvania Orders for Life-Sustaining Treatment. If your patient had a flag in this column, it's letting you know that they have wishes in case of an emergency. Discharge order and discharge instructions will flag when your patient has an order to be discharged. I'd like to see the orders for my patient Eve. I'll go to the second tab, which is the orders. All of her current orders are displayed here, and they're broken down into these department categories: lab, nursing, dietary. Toward the right, you'll see a status column, and this tells you if these orders are still active and pending, or they may have already been performed, canceled, or discontinued. If you need to collect a specimen and send it off to the lab, you can do that here. So I have a urinalysis that is pending, and I have already collected it. I'm going to put a little check in the box. You can either right-click over that order, or the icon is Add Specimen. This is pre-filled with the order name, and then I need to add a start date and a start time. Selecting the large arrow will open the calendar. Today's date is circled, and then I can type in my time. And then OK. This is a warning because I am in a training system and we're not really communicating with the real Sunrise system. I'm also not really printing anything today. But notice that I no longer have a pending urinalysis. The next tab is the Results tab. Here you can view lab results as well as blood glucose results for your patient. You'll see different color flags. A green flag means it's a normal number. A red flag is an abnormal number. And a yellow flag is a text or a typed up result. If I just want to view one result, I will double click over one flag and that result will appear. When I double clicked over the flag, it changed my display view. Selecting summary will take me back to that summary grid. Depending on what I've highlighted is what will display. If I want to see more than one result, I can highlight a category and view everything from that category. Again, I'll change my display view back to summary. Maybe I want everything for a particular date. I could highlight the date. And then again, everything will display for that particular date. The next tab is the Patient Info tab. Many of these items are for physicians and unit clerks. If there's something you are not allowed to view, you will get a warning. For example, if I were to try and view the patient's health significant event, if I was trying to view the patient's address, here's the warning: I don't have the correct privileges to perform this operation. I can view their care providers, which would be their attending physician, their consulting physicians, as well as a social worker. Health issues will be their chief complaint. Significant events is advanced directive information. And we don't use the data entry section. This is for the registration clerks. The next tab we'll look at is the Documents tab. Any document or note for the patient will be listed here. This includes physician, nursing, care management, emergency room, as well as inpatient. A single click will open the note on the right-hand side. A double click opens it in a larger window. The next tab is the flow sheet tab. This is where nursing assistants do the majority of their documentation. You will do documentation here every day for your patient. Toward the bottom left, flow sheet selection. These are the different flow sheets that this particular patient has. Depending on the patient's location are the types of flow sheets. If Eve had been in the emergency department, I would have an ED flow sheet. If she had been in the OR, I would have a peri-op flow sheet. You will use a vital sign flow sheet every day for your patient. You will use a nursing care documentation every day, as well as an intake and output flow sheet every day. I'll finish the overview of Sunrise and then come back and do some documenting on the flow sheet tab. The last tab is your clinical summary. This is a summary of your patient's chart in one area. There are different views to choose from, and CNAs do have their own view here. This can be set as your default by selecting the icon Save Display Format and save as the default view. Here you will see intake and outputs, vital signs, as well as other documents, orders, allergies. Right now I'm viewing the clinical summary for Eve Arden. If I want to see the other 7 patients on my list, I could then at that point use the icon Next Patient. Now I'm looking at Ingrid's clinical summary. Back to patient list. Other icons across your toolbar. Refresh will pull in new information, new orders, new results. Find Patient and Find Visit will allow you to search for a patient not on your unit. Find Patient is generally used as an outpatient search, and Find Visit if you are looking for somebody who is currently in the hospital. If I'm getting a new transfer to my unit today, I want to put him on my patient list. I'm going to use the Find Visit icon, the patient's last name. You can then hit enter or your keyboard or search to the right. The patient will be listed below. This patient here is at Tarsdale 3A in room 3351. To add him to my patient list, I will highlight his name, select the button Save Selected Visits. Again, my patient list is selected and okay. James T. Kirk has now been added to my patient list. You will not need the next document, the next icon called My Enter Document. We'll go to the Worklist Manager icon. The Worklist Manager will allow you to see what tasks are due for your patients. You can either choose to look at this patient, meaning one patient at a time, or most likely, most nursing assistants generally choose to look at their entire list. That option would be med/nursing care, the current list. You also have the option for an 8-hour or a 12-hour shift. It's defaulting to today's date, and it's giving me an hour before my shift and an hour after my shift. Any of these dates and times can always be changed and then updated to update your work list. The patient's names are listed in gray and the tasks are listed below those. A yellow task means something has been scheduled. So this patient, Eve Arden, has a blood glucose ordered 4 times a day, and it plotted out the schedule for 7 a.m., 11 a.m., 4 p.m., and then 10 p.m. if that were on my particular work list to see. If I want to document that I did my 7 o'clock blood sugar, a double click, and I said I've done it. Check mark means it was done, and then those are my initials. To document that I did not do something, let's say the patient refused the 11 o'clock blood sugar. Here I will right-click over the 11 o'clock task and select the third option, Mark as Not Done. It wants a reason why I did not do that. Patient refused is all the way down here at the bottom. You do not need a comment. You certainly can type in there if you need to, and then OK. The red X, not done. Right now, it's only 2 o'clock. I cannot document my 4 p.m. blood sugar. It's going to tell me that I cannot go that far into the future. You can document in the past, but you cannot go more than 1 hour into the future. The task form will open. If I needed to document against this, I could always change the time. Otherwise, I will X to close that. You can always edit any of your own documentation. You can either double-click over your initials. I can modify this form if needed. Maybe I wanted to change the time, or maybe I wanted to add a comment. Your other option for editing is a right-click. A right-click will open a menu, and I can choose Edit from the menu. I have several options here. Document form would open that original form if I needed it. Other options for edit, I could change it to done or change it to not done. And the third option is I can reset the task status. Maybe I charted on the wrong patient. I can put it back to that yellow cell. Again, it wants to know why. And it is back to the yellow task. I would then go down and do the rest of my patients. Here's Ingrid. If I did her blood sugar, I can double click. And if she refused her 11 o'clock blood sugar, again, that was a right click, marked as not done. And editing is done with a right click and choose edit. You can close or X to get out of there. The next icon is the printer, print reports. Most nursing assistants like to print a worksheet of their patients to jot down various items throughout your shift. To print a worksheet, you need to change this report category. That report category that you will use every day is called nursing forms. Here I can print a vital sign worksheet, or if you're working night shift, you can print patient weights with orders. This will list any patient on your unit that has an order for a daily weight. The allergy summary is another way of looking at your patient's allergies. The signature manager, if you ever were required to sign off something, the signature manager is where you could sign that off. This is generally used by physicians. Drug info, expert advice. This is just an FYI. If you're interested in about a particular medication, this will give you pharmacology, side effects, and different brand and generic names. Health issues will list your patient's chief complaint. More header info. So this area here up in the blue is considered the header. This icon will give you a little bit more information. Again, it will list the patient's admission, date, time, their height and weight, their allergies, as well as their other care providers. Again, the social worker or care management person will be listed here. The missogram. This is a miscellaneous icon, which will take you to our intranet. The dietary snackogram and the miscellaneous missogram would allow you to send messages to other departments that you need stock for your unit. The free text missogram wants to know where you're coming from. And who are you sending your message to? SPD is our supply and purchasing department. Submitting requests will send the message to that department. There are some other miscellaneous information here as well, such as height and weight conversion charts, pounds to kilograms, inches to centimeters, care management and all of their phone numbers, linguists and translators, as well as their phone numbers, pastoral care, this is physicians in the neighborhood and their phone numbers, and physician phone numbers as well. The last icon is a typical calculator. If you need to order supplies for one individual patient, that icon is up here all by itself to the left of your patient's name in the patient header. It will default to the correct patient, and it's requesting by me. There are two ways to get to the orders. One is by typing here to enter your order name. This is what is called manual entry. If I want to order an ACE bandage for my patient, I'll type ACE. And I have several different size ACE bandages that I could order. If I want the 6-inch ACE bandage, you can either double click it or highlight and add to the right. It drops to the lower window where I can add more supplies if needed. The quantity defaults to 1. If I need to change that, you can highlight the order and select edit. The other option for finding orders is called start a browse, meaning you can browse through the different departments. If I wanted to go to SPD, again, our supply and purchasing department, there's bandages and there's the ACE bandage. Again, I could get to it that way. Items that you'll order on a daily basis are generally kept in stock on your unit. If I needed to order the leg compression sleeves for my patient, typing sleeve would allow me to order those. If I needed a toothbrush, a razor. When finished, select the button at the bottom, submit orders for your patient. Again, this is an error because we are in the pretend environment. We are not actually submitting orders. On the orders tab, I can now see those SPD items that I added. And the last thing we need to do is our flow sheet documentation. I'll select the flow sheet tab, and we'll start with the vital sign flow sheet. All flow sheets will function the same. It will just be the content that would be different. To add a column to do some documentation for this patient's vital signs, I'll select the icon, Add Time Column Options. You're always going to add a single time column. It defaults to your current date and time. This can be changed if needed. I now have a time column for today's date and time. The little lock icon at the top of the column lets me know I am actively working here. And when I'm finished, I have to remember to save it. If you forget to save it, you will get a reminder that there is a flow sheet unsaved. Clicking into the box would allow me to type any information. The pound or hashtag symbols appear. You can just type right over those. It will automatically convert it from Fahrenheit to Celsius. The third option here is for the site. These are not mandatory. And if you ever would like to type your own option, it's at the bottom of the screen. This is where it would allow you to free text any information. Selecting OK will take you to the next selection. To close these boxes, you can cancel or X. I'm going to go down to heart rate. An abnormal value would give me a red arrow. A critical value will give me a double red arrow. Again, if I don't want this pop-up box, I can cancel. I'll go down to respirations. SpO2 is pulse oximeter. Below that, patient on. The hospital policy at Jefferson Northeast is if you document a pulse oximetry, you need to document if the patient's on room air or if they are on oxygen. Blood pressure. The source, if you needed to document, would be the right arm, the left arm, or the leg. The mean is automatically calculated. Height and weight is next. Height and weight is done in metric only. So kilograms for weight and centimeters for height. Below that, you'll see a pain section. You can ignore that. Once you're finished with your height and weight, you are finished with your flow sheet. This is still actively open. I'll select save. The lock icon is gone and this flow sheet has been saved to the patient's chart. Because again, it is my documentation, I can make changes if needed. Clicking back into any number would allow me to make a change. Again, I'll have to remember to save it. Even after the column is saved, if you need to make a change to the date and time or remove this column altogether, those options are done by right-clicking over the date and time, and you have several options. I can change the time, again, as long as it's not more than an hour into the future. I could delete the entire column. Edit text would allow me a free text box at the top of this column. And again, if finished, I'll go ahead and save that flow sheet. The next flow sheet we'll look at is the intake and output flow sheet. To add a time column, I'll use the icon add a time column option. And again, it's always a single time column. Change date if needed or time. I now have developed this white column for today's date and time. This intake and output flow sheet will auto-generate an 8-hour total and a 24-hour total. The white boxes are where you'll be doing your documenting. So my patient had drank some oral fluids today. I'll click in here and add the number. Under output, I have some options for catheter. I have voided mLs, meaning it was actually measured, or voided not saved count. That's asking me how many times did they void? We didn't actually measure it. Did they go once or twice? I also have stool count unmeasured, again, once or twice. Same functionality. If I'm finished with this flow sheet, I will save it. And your other required flow sheet every day is the nursing care documentation flow sheet. Again, I will add a single time column. And begin my documentation. The safety section is mandatory for every patient at least once per shift. Here I have multiple questions that I need to answer. Did I verify the patient's ID bracelet? Does the patient have suction set up in the room? All patients must have suction set up and it must be working. Is there a TABS alarm with the pad in use for this patient? The yes is automatically opened. The no is collapsed. I'd have to click into that little expand icon to get to those options. Did the patient refuse or was it non-applicable? Bed exit alarm in use. Did you test the alarm? Did you redesign the room to make sure there's a safe path for the patient to get to the bathroom? Meaning, did you declutter the room? Then we get down to hygiene, activity, and so on. These are optional depending on your patient's status. If I did not give my patient a bath, again, I could just okay and jump to the next section. And maybe I did help them with a shower. So again, these items will be specific per patient. Activity, turning, and positioning. All patients need to be documenting their activity. If your patient needs to be turned by you every 2 hours, you do need to document that along with the time. I could type in here, turn to right side at 12 noon, then 2 p.m. out of bed to care. Or you could open an individual flow sheet for 12 noon and 2 p.m. Number of people to assist patient back to bed. Did the patient ambulate? Any ambulatory devices? Were they on complete bed rest? Bathroom privileges? Bedside commode? Did they sleep? Dangling, did they sit along the side of the bed and dangle their legs? Any positioning options here? I'll say that we elevated their heels off the bed. Bed positioning, how many degrees was it elevated? Any immobilization? Any rotation devices? Positioning devices? And then diet. Again, once finished, I have to remember to save this flow sheet. If I check my clinical summary tab, I should now see the documentation I added. So here's the intake and output that I added for this patient, and along with the vital signs that I just added, and those are the current dates and times. This concludes the instructional video on the Sunrise documentation system. If you have additional questions or need assistance, please contact the help desk. That number is 215-612-4026.